A lot of dentists do struggle with direct composite veneers, and at first, yes, I did find it a struggle, and there are some cases today where I would need to think twice about executing that case. But the easiest way to kind of break it down is, in actual fact, composite veneers are quite simple. In my opinion, the most difficult cases that you can treat with composite resin are black triangles. And the reason being is you're restoring an interproximal surface where access is quite difficult. After black triangle cases, I then find diastema closure cases quite difficult because once again, you're working in between teeth. So the management of the material in between teeth becomes a lot more critical to avoid you getting overhangs and avoid inappropriate emergence profiles. So you want to try and get that natural curve from the cervical area as you approach your contact area, which can be difficult doing it freehand. Now, a lot of the composite cases out there, many patients don't actually have diastemas or gaps between their teeth. So you're actually only adding material to one surface of that tooth. And believe it or not, that is much easier to manipulate the material when doing that than when you're trying to close gaps between teeth.